Hello, welcome to our show, We Smile. My name is Dr. Nadia Al-Aasm. Our show is to focus on topics related to dentistry, and these podcasts are meant to be interactive. So today is more of an intro show, but I plan to take on questions, topics, suggestions from you guys, and I'll let you know at the end of the show how you can reach out to me if you have any dental related questions or topics that you want me to discuss in the future. I'll make sure we give you an email and we'll make sure we get it on the show. I also plan to do a few interviews from local specialists who can shed some light on their specialty, be it orthodontics, related to braces, oral medicine, nutrition, etc. And we'll have some local guests on here who can bring their feedback to the table. Let me first start by introducing myself, and I'll tell you a little bit about my background, essentially how I got into dentistry. So I grew up here in local Windsor, South Windsor. I got my undergrad at the University of Windsor, and then I went on to get my Doctor of Dental Surgery from the University of Detroit Mercy. I have been working in Michigan for the past 7 years, but I'm so happy to be back working in my hometown, YQG. Well, technically I never left. I was doing the daily bridge commute for 7 years, but I'm happy to be in my hometown. So dentistry in and about itself excites me. I'm the definition of a dental geek. So my husband catches me on a daily basis watching Instagram videos of teeth being prepped, YouTube videos. That's just what I do on a daily basis. I love continuing education, and after graduating, I dabbled in a few things. I took a couple of courses in forensic dentistry, where I actually went into the Detroit morgue. I helped out with a few cases. It was pretty interesting. It was a rewarding experience, but I then focused on cosmetic dentistry, Invisalign, crown and bridge, and worked in private practice. I loved that. I was able to kind of connect with the people, interact one-on-one with my patients, and I'm able to change someone's smile. So I am the owner of Cabana Dental, and I love being able to focus on really applying my love for dentistry, my philosophies, and my passion into my practice. Anyways, that is enough about me. That this podcast is more about being able to interact with a broader audience and being able to interact with you guys, and more about being able to take what I love, break the stereotypes, change the norms, and educate in a fun way. Today is going to be more of a lighthearted talk, so stay tuned. And I think we're going to talk a little bit about Halloween. It's right around the corner, so we should focus on some dental facts for children's parents and some tips. We'll also talk about a little bit of dental-related myths. So I'm a mother of 3, so this is where I can really relate. I have a 6-year-old, a 4-year-old, and a 17-month-old. So I got my hands full, but I can relate because I feel like every 10 minutes my son walks up to me and asks for a snack. He's my 4-year-old. It's kind of a joke in our house because all I ever hear him say is, "Mama, I want a snack. I want a snack. I want a snack." So I'm nervous with the Halloween candy flooding the aisles and all that opportunity for cavities. So let's talk about cavities. Basically, what is a cavity? I tell the kids it's caused by sugar bugs. But what really is happening is the tooth decays, it breaks down, it causes a hole that eventually grows bigger and deeper over time. And what's really happening is the bacteria in your mouth is breaking down any carbohydrates, breads, sugars, refined sugars especially. It breaks it down into acids, and that eats away at your tooth. And what's kind of the one tip I want you guys to leave with today, it's about the frequency. So the frequency that bacteria encounters these sugars is what really damages the teeth. So here's an example. Let's apply this to juice. For example, I like to say, sipping all day causes decay. So if you're drinking something other than water, juice, pop, for example, if you can't cut it out, think moderation. Moderation's the best. It's better not to sip all day on it, but just pour yourself a glass, finish it in one setting. Because every time you go to have dinner, if you're taking that pop and you're drinking it just with that setting, is better than if you're sipping all day on that same glass of pop, because you are allowing the bacteria to kind of break down these acids more. Same applies to snacks. So try to limit unhealthy snacks when possible. Sticky foods, candies are the worst because they get stuck in the grooves of your teeth. So you want to think of snacks like hard fruits, apples, vegetables. When you're packing snacks for your kids, try to make it fun. You can think of, apples, fruits, putting them on little barbecue skewers, something that will kind of make it fun in the kids' lunches. Try not to send them with fruit snacks or anything like that, because that will kind of sit in their grooves of their teeth all day, and that can cause cavities. Also, in terms of Halloween candy, you can basically rate the worst ones as the ones you would think would be bad. So the sticky, chewy candies, taffy, caramels, those are the worst. Chocolate is a little bit better than candy, but again, make sure you're thinking moderation. This year, I'm super excited because I really didn't know how to go about this Halloween thing, because we all know that kids are going to be asking for candy. I struggled. I thought to myself, do I give out toothbrushes if we have kids come in the office and ask for candy? And I was thinking, am I that person going to give out toothbrushes? Well, I'm a dentist. I can't give out candy, right? So I recently came across this brand of sugar-free lollipops, and they actually contain an all-natural sweetener that doesn't cause cavities. It's actually dentist approved. It was made by a dentist couple, and I'm going to explain this because I have a lot of people asking me about how this works. I have the candy and I've been showing them, and everyone's been asking me, well, tell me how it works. So I'm going to explain it, but basically it's made up of xylitol instead of sucrose. So xylitol is a natural derivative, and it's derived from numerous plant sources, as opposed to the refined sucrose. The bacteria in your mouth can't break this down as it would with the other synthetic sugars, so it can't contribute to the cavities, because if you can't break it down, then no acid is being produced. They actually taste amazing, and they don't taste like sugar-free lollipops. And if anyone wants to try one, feel free to stop by my office, grab some to try. You'll be amazed. We're located in South Windsor. It's 300 Cabana Road East in the Armando's Plaza. And we got some up front, but it's a pretty cool alternative for Halloween candy. Just something to kind of think about. I'm gonna go on to talk about the second segment of the show about dental myths. So most people, they fear the dentist. They must have heard some sort of dental myth or horror story at some point in their life. We'll kind of touch on this. This will be a whole separate show at one point. But I'm just going to go through the kind of the basic myths that you might hear, because some dental myths can affect a person's perception of the dentist, and what, can cause them to put off a visit. So that could end up leading to long-term dental problems or other oral health issues. And we want to get any issues when they're, small or simple. So kind of preventative is the best way to go. So let's talk about these myths. So myth number 1, brushing before the dental appointment will make the dentist not notice that regular brushing is not done since the last dental visit. So not following the recommended 2-minute brushing twice daily will make your gums red, swollen, bleed easily. It can make it a little bit more obvious to the dentist, but basically you just want to make sure that you're in for your preventative care. We recommend every 6 months getting your teeth cleaned, and it's more than a cleaning. We're checking to see how your gums are. We're checking to see if there's any pockets, and any tartar buildup that sits there essentially becomes hard, almost like a cement that you can't no longer get off with a brush. So we need to have a hygienist or dentist clean that off and just kind of promote healthy gums. Myth number 2, if the gums are bleeding, brushing and flossing should not be done. So opposite is true. Regular brushing and flossing is needed to remove that plaque buildup, which causes that gum bleeding. And bleeding is a sign of gum inflammation. So more care must be practiced to avoid, harder to treat oral problems. Myth 3. Children should not be taken to the dentist until they are 2 years old. So that's a myth. The Canadian Dental Association actually recommends that the child be taken to the dentist by the age of 1 for good advice on how to take care of your child's teeth, promote healthy daily routine, kind of go over important things. One thing I can kind of stress is try not to put the child to bed with a bottle of milk, because that can sit on the teeth when they're sleeping, and that can cause cavities. So that's even just regular cow's milk in the bottle at nighttime. Just keep it away from the crib, and that really helps. Myth number 4. Teeth whitening is harmful as it can damage the teeth. Teeth whitening done professionally will cause no damage to the teeth enamel, but it may cause a little bit of sensitivity and gum redness on a short term. Myth number 5. Women lose a tooth for each child they have given birth to. So this is more of an old wives' tale than a myth, and it is untrue. Hormonal changes while pregnant can exaggerate the bacteria in your mouth that can cause bleeding gums, gingivitis. Tooth loss is unlikely, though, if you are following up with your thorough and regular cleaning regimens. Here's another myth. Dental x-rays are unnecessary. So that's false. It is necessary to have dental x-rays. This lets us see if there's any decay or other problems. And it should not be feared because the radiation dose is actually very small. It's especially when we're using digital radiography, which most dentists are now. The radiation is actually less than, say, going on an airplane. So nothing to be fearful of. Here's another myth. Weight loss can affect the fit of your dentures. The shape of your bone under the tissues determines the fit of your denture. So weight loss has nothing to do with the denture. So just a couple myths. If you have any suggestions on what you want to hear, if you have any myths that you're unsure about, make sure you let me know. I hope you enjoyed our intro show. Should you have any suggestions about the show or topics, like I said, feel free to direct message me. You can direct message me on Instagram, Facebook. That would be under Cabana Dental, and I'm going to kind of look at those, read those messages, or you can actually even email me at info@cabanadental.ca. This has been an awesome intro show. I hope you guys enjoyed it, and there's more to come, so stay tuned. And I can't wait for the next show. Thank you.